Yourself?
Hi, everybody. This is Pam Baston. It's a pleasure to be here, and I know I've spoken with many of you before. I'm with JBS International and have been in the field 40 years and am looking forward to spending this time with you.
Yeah, good morning, everyone.
Harold?
Harold Tarbell. I'm a Mohawk from the community of Akwesasne, and I've been facilitating for 20 years, and former tribal chairman and former member of Nanakoa. And I was realizing as I was reading the other day, GONA, the Gathering of Native Americans, gets a lot of attention and a lot of support, and rightly so. And I was very fortunate to be involved in that development when I was the tribal chairman. Shall we launch in? So here's the agenda, and essentially our agenda is pretty straightforward. We essentially try to take the topic in pieces and work our way through the strategic planning process. In terms of our discussion today, we're going to try to talk about the goals and the objectives and give you some samples of goals and objectives and how that relates to your grant and how you could sort of make those connections and fulfill the grant. We try to define it and then we try to apply it as much as possible, and you'll see that we try to provide some time for a bit of Q&A as well. I do want to emphasize Jeff's comment about downloading the files that you see at the bottom middle of the screen, because we'll be referring to those, and we've inserted much of it into the slides, but it'll be a much better view on your computer if you open the document directly. I'm thinking in particular of the SAMHSA strategic plan, the NIDA, National Institute on Drug Abuse strategic plan, and the FNHA one, the First Nations Health Authority one. Those will be specifically speaking to them today. Just noting the handouts, when it says handouts TOR, TA, November 16th, those are the slides we're going through, so you'll have those available as well. I think we'll just jump right in, just in terms of our focus today, developing strategic goals and objectives to align with the tribal opioid response grants. And did you want to speak to these?
Can everybody hear me?
I can.
Okay, I'm going to try. There's some definite technical difficulties happening.
Do you want me to go through this, Pam, and then have you come back in when we get to the goals and objectives?
Because I hear everybody echoing.
Okay, yeah, it seems to be fading in and out on this particular call. Let us know in the chat room, everybody, if you need to be aware of some stuff. All right, so as everyone knows, in the FOA, the funding opportunity announcement, there were specific requirements, and many of you responded to them regarding strategic plan, but primarily focused on this need to understand the gaps and the needs that you're trying to address and how you're going to use the funding to essentially fill those gaps, whether you had a needs assessment or you're going to do a needs assessment, or whether you had a strategic plan or are going to do a strategic plan. Essentially, that's what it's calling for here. And we had noted in our previous conversations that people are taking a variety of different approaches. Some are doing comprehensive strategic plans. Some are building off of other strategic plans. Some are building off of other tribal action plans, and some are using other models. And there's a few who are, in fact, doing a bit of a modified approach to developing strategic plans themselves. Here, we always like to emphasize the goals, because these are the kinds of things that you're responding to. So these are the priorities you're responding to. So to address the opioid crisis in our communities by increasing access to culturally appropriate and evidence-based treatment, including MAT and the use of the approved medications, and then reducing unmet treatment need and opioid overdose-related deaths through the provision of prevention, treatment, and recovery activities for opioid use disorder. So just to try to give you a sense of that focus there. What we've done is we've tried to clarify and demystify the strategic planning process, and we've been using this slide to show you essentially one version of the 7 steps that are going through. What we've tried to do in each slide is highlight the areas we're focusing on. So when we talk about goals and objectives and the linkage to the your tribal opioid response grants and your program plans, this shows up in a couple of different areas of the strategic plan. So that whole agreeing on priorities, the actual drafting of it, and then the implementation. And I do want to note here that core strategic directions and strategic goals and objectives, and then program or operational goals and objectives that you see in implementation are related but can be slightly different, with increasingly more detail as you get down into those layers. So that's what we're going to focus on today. Just by way of background from a strategic planning context, so there's many models for developing goals and objectives, and how they align with other elements in a strategic plan. So, we've shown you a few models. There's always going to be a few models. Different consultants you'll work with will have different models. They all have the same intention, but, just to be aware that you'll see them in different shapes. And, we really just encourage you not to be befuddled by that, different approaches that you'll see. The bottom line is, I've said on a few of the webinars, let's not spend all of our time arguing about the definitions, and let's not quibble about that. There's a certain alignment that's needed, and really what I'm trying to say here is the important thing is that you, your program, your organization are the relevant pieces of it, and your funder and your key stakeholders kind of have a good common sense of that in terms of what the format's going to be when you're talking about goals and objectives, what generally you're referring to. Again, I wouldn't spend tons of time doing that. The next bullet point is really just trying to say, no matter what model you're using, or no matter what, quote unquote definitions you come up with, there has to be a logic of it. You really do want to make sure that as you're coming from your parts of your strategic plan, from your vision to your mission to your values and your principles to the priority focus areas, whatever those are called, to the goals and objectives, to the strategies, to the tactics, to the activities, to the program, all of those kind of things, there's a logic to it. And essentially, as you move from the broadest vision, so to speak, down to the more specific, it should start getting more and more specific and a little bit more detailed. When you look at both of them, the smaller, more detailed pieces and the larger, bigger vision, they really should be informed, and you should be able to see that flow back and forth. And then when you start at the smallest level, so let's say the activities, and you start building up, you should be able to see that if you achieve this activity, then you will contribute to this goal objective. If you fulfill that objective, you move closer to this goal. You move closer to this goal, you're feeding into the vision, or the mission and the vision. So, there's a bit of an internal logic to it. Just noting that sometimes as you're going through the process and shaping it, it does get a little bit of fuzziness in there, but it is, that's the internal logic that you're trying to achieve here. This one shows a kind of some of the flows. This next slide shows the flows in a couple different models. So you'll often see a fairly standard framework. They talk about core strategic directions. We talk about goals, objectives, activities, and outcomes. We're going to give you a little bit of definitions on goals and objectives in a bit, so I'm not going to read through that. The middle one is the strategic planning body of knowledge, which is an association focused on strategic planning. They talk about goals, strategies, objectives, and tactics. And again, you'll see the wording is fairly similar, but they just say there's an order to it. And in our last call, we talked about strategies. Depending on where you are, you're applying strategies at many different levels. And then there's another model we talk about, the balanced scorecard, fairly detailed model. They actually don't talk about goals. They talk about strategic themes and strategic results, which I would describe as goals, but that's their language. Then they talk about their strategic objectives, and they really focus on that, and they go straight from the objectives to their performance measurement. Then they get to what is it we're going to do. So we might call it our program focus or program objectives. So those are the different ways you'll see it laid out, and just understand they're all trying to achieve that internal logic I mentioned earlier. It's also important to note that goals and objectives are used and may be used in multiple ways, and they do contemplate them in the models. So we can, depending on how detailed your drafting is, there can be strategic goals and objectives. There can be operational goals and objectives, program specific, project specific, and a little bit later I'll talk about the distinction between process objectives and outcome objectives. So just lots of different ways that you can see them played out. So to me, there is no one magical, perfect way to do it. Uh, Pam's going to talk in a bit about sort of the advice and the guidance that SAMHSA has provided, and essentially, we want to look at that as sort of the priority. Um, a lot of times when you talk about strategic planning, they'll talk about sort of the levels. So we'll often talk about bird's eye view, the airplane view, the rooftop view, the mountaintop view, and the on the ground or the porch view or the on the ground view. And it's just really about thinking about your goals and objectives at those various levels. Um, and essentially, I would say the distinction we want to make is that the goals and objectives that you're putting in, that you have already put in your proposal and which have been funded, are at the program level compared to the strategic objectives, which are essentially trying to get to the why are we doing these program activities? Why did we propose to do this? Because we thought they would achieve the broader goals of reducing overdose, reducing the impact of the crisis, and meeting those larger goals. So just trying to find a way to lever that. So the way I always try to think of it, strategic goals try to get more to the why you're doing things, and program goals kind of get more to the what. And that'll be that distinction between process and outcome we talk about in a little bit. Here's just a graphic from the balanced scorecard, which kind of gives you one version in terms of the way they look at their strategic objectives. Sort of vision and mission is the airplane view, the bird's eye view. What they call their strategic objectives is sort of that mid-level mountaintop view kind of thing. And then program and project goals are the ground level stuff. And essentially what they're talking about here is, if you're looking at it from a strategic perspective, you want to just be careful in terms of how you word those so that you're getting sort of the right kind of focus there. And they give you a few examples in terms of the very straightforward, let's see, formula they use for their objectives at that level. Just in terms of some examples, in terms of how people deal with it in different terms, when we went through the 7 steps, I noted it. So the strategic planning process anticipates goals and objectives playing out at different levels: a strategic level, an operational level, a program, or a project level. And again, depending on which model you're using and which table of contents look like, you may be able to get into each of those levels. What we have here is a footnote from the SAMHSA's current strategic plan, and I thought it was very important to read, just in the sense of how they deal with the fact that they have, in addition to their strategic goals and objectives, which we'll show you as an example later, they have a bunch of other goals and objectives, in their various divisions and programs and units and projects and initiatives, including this one. So given the broad range of issues and populations that SAMHSA addresses, this strategic plan is not intended to be an inventory of all the objectives or activities SAMHSA will pursue. Rather, the strategic plan presents priority goals and objectives reflecting important changes and outcomes that SAMHSA aims to achieve over the next 4 years. So again, trying to say, for them, strategic objectives are the priority amongst all of their objectives, and sort of trying to find that bundle and a way of framing that. The other thing that they note is we talk about, how do you relate to all these other plans that are out there, and particularly all these other strategic plans, which may be in a broader organization, in the tribe or the broader organization. And here they just reference how they're going to align with other relevant strategic plans. So that might be a good model to use in terms of how we're anchoring the strategic plan or the action plan or the planning framework that you're using in your grant response to the tribal strategic plan or the broader organization's strategic plan, for example. So they just try to emphasize how they relate to either those core priorities or some of the goals and objectives more specifically. And the language I've used in the past is, how are we informed by and how are we contributing to these strategic objectives? Pam, we'll turn to you to sort of then take us into the more technical details of goals, I think. And just as we're making that transition, so
Can
again,
you
from
hear
a
me?
strategic, there you go. Good.
Okay, I'm going to try. Goals, high-level strategic goals, have a number of characteristics. They describe a future end state that is supportive of the mission and vision. They describe actions in actionable terms. And they relate to the expectations and requirements of all the major stakeholders and employees and reveal the underlying reasons for running the business. It implies a completion date at some point in the future, but not defined at this point. Can be divided into milestones that in turn can be translated into achievable, assignable, and measurable objectives, and also involve operational planning, which is a process of converting strategic goals and objectives to tactical goals and objectives. Managers and staff often find it easier to align their own efforts on goals rather than on the more generally stated vision and mission statements. And these goals should not be a group exercise. For large organizations, each program and administrative manager should take a lead on their unit's goals and objectives. For smaller organizations, one or two people should take responsibility for drafting initial goals and objectives. Several iterations may be necessary before a final document is agreed upon, and important questions often arise and insights emerge. And Harold, I know these last couple of slides were yours, and you might have an opportunity to expound a little more, particularly on, for example, why this should not be a group exercise.
Yeah, it just two things. So the first draft is never really. It's good to have the first draft, and it allows some freedom of thought. And essentially, they're really trying to say, one or two people to draft it, to do the initial drafting. I think you want to get buy-in and commitment from others, but I think just really here, it's the sense of drafting. It's the splendid isolation of writing is really what they're trying to emphasize. And it is quicker that way. I think you do have to be open to modification because you not only want it to be more precise and clear and distinct, and Pam's going to go through the sort of some of the formulas for that, but you also want to get some commitment and buy-in by other people being able to shape those. And I think that last point there, important questions often emerge, often arise, and insights emerge. That's that whole piece about from the discussion, a lot of clarity and unraveling of the complexity arises. And it's kind of one of those places where participating in the process is just as important as the product that comes out of it. That's all I wanted to add, Pam.
Okay. So then the goal is a broad statement about the long-term expectation of what should happen as a result of your program, so the desired result. And I think the important thing here is broad statement. This is not where you get into the weeds and get into the details, but just a very broad general statement of, at the end, if you're trying to, if you reach what it is that you're intending, what would that look like? And something broad like reduce substance use. That doesn't tell you how much or by when or by which strategies, so there's no details in the goal. It serves as a foundation for developing your program objectives. Goals should align with the statement of need that is described, so you would then go back looking to your application to see what is it that you said you were going to do, what were the problems you were trying to address in your community. And so in that very usually section A of your application would be where you would find that statement of need. And we know that the goals in SAMHSA involved increasing access and reducing overdose. So theoretically, your Section A might have spoken about how that looks in your community, and that's basically what your goals would cover. And also that they're generally only one sentence. In other words, it's not all the details of how you get there, but just the broad overarching direction that you're heading. Goals address outcomes, but not how they will be achieved. Goals describe the behavior or the condition in the community that you expect to change. So if the behavior, it might be substance use, it might be school dropout, it might be fewer babies born exposed to opioids. So, it's what it is that the condition you're trying to address. Goals describe who will be affected by the project, will lead clearly to one or more measurable results, and again, are concise. So a couple examples might be increase tribal member access to MAT. That would, of course, line up with the SAMHSA goal. Decrease opioid overdose among tribal members, another goal of this particular initiative. Increase effectiveness of OUD treatment of tribal members. So increasing effectiveness, again, a general goal doesn't tell you, well, how would you increase effectiveness? What would you do if you wanted to increase effectiveness? But that detail would, of course, then be the objectives and some of your strategies of how you would actually get to that. Because as we say, there's many roads to Rome. There would be many ways that you could actually accomplish that. And how you choose to do it in your community with your tribal members is what would be contained in the objectives and strategies. Decrease access barriers to recovery housing for tribal MAT recipients. I mentioned in a prior webinar that a lot of folks that go through medication-assisted treatment and they finally get stability and their lives are turning around and maybe they're in a residential program and they come out of that residential program and perhaps they don't have a safe place to live and they finally find some recovery housing that they can live in and they're told, oh, well, you'll have to get off that MAT in order to stay in our recovery house. And so that's a huge barrier. So your objectives would then detail, well, how would you decrease that particular barrier? So I want to stop there and ask questions, and we are still having some technical difficulties. Apparently it has something to do with the folks who are calling in are affected. They're having a bad reception, whereas folks that are hearing through the computer are not. So I am going to turn this over to Kate to figure out how I can help with the question and answer when I've had to now mute everything in order to be able to present.
Kate or Jeff?
Sorry, Pam, can you clarify that question?
So I was saying, Jeff, I cannot hear questions. I have to shut the audio off when I am not speaking. It's the only way that this, I guess you're having trouble with the phone line, and that's the only way I can speak. So I hear nothing. I could probably see something in a chat box,
People
but
should just be able to put their questions into the
probably
chat
not
box.
going to be able to answer questions unless they're somehow in a chat.
Yeah, I think the chat would do fine. Anyone on the line right now, if you have any questions so far, just please type them into the chat box and we'll try to get back to you. We apologize again for the audio difficulties. A recording of this should be available on our website in the next few days, so you should be able to, if you're not able to listen in now, you should be able to view it then.
Okay. So the question that I see is, what is a good number of stakeholders to use when collecting information for mission, vision, and goals? And that's really Harold's expertise. So I will shoot that question to Harold.
Yeah, that's a six of one, half dozen of the other. It is quite possible that your planning group or your management group can do that. You can involve. I tend to like to do when if there's not one that exists and we're building a new one, I like to involve the governance side. So whether it's our tribal government or the board members, however the organization is structured, and at least the senior managers in the organization, those are pretty critical. Sometimes you have the latitude and the luxury to involve, you know, everyone in a supervisory role. Um, so it kind of depends on your circumstances. I think here you would be the challenge for you would be just the time limitations that you have and how much you can fit into the process. The other dynamic is that it's perfectly legitimate in strategic planning to engage your external stakeholders. So you could engage your funders, you can engage your neighbors, you can engage your partners in that process. So, for example, if you're doing your educational strategic plan, you could engage your, neighboring universities. In terms of the opioid, often a dynamic is engaging your outside providers because sometimes having that coordination or people sort of um, playing the systems against each other is a big factor that we have on the addiction side. So, there's a certain value to it. But I think in this context, you would probably be um, doing much more rapid strategic planning than you would normally have, where you would normally have a bit more time than the end of this month. Okay. Anything else? So we soldier on, Pam?
So Harold, are you going to continue forward, or what's your pleasure at this point?
Yeah, I think we will. So again, we'll keep an eye on the chat room. Please, at any time, feel free to add a question there. And between Pam, myself, and Jeff, we'll try to pay a close eye on that and build it in to the discussion. I do want to remind everybody as well, while we're looking at the screen, to complete the poll in terms of attendance at the gathering in April in Minneapolis. To do that. And also remind you that as we sort of go through this, downloading those files will also be very helpful to you as we go through. All right, I'll carry on. I mean, so you have your broad context, you have your proposals that you've made. We've sort of described where you want to be, both in terms of strategic goals and then just more detailed goals and sort of structuring them as well in terms of, let's say, a formula for that. Sort of as we sort of move forward and look at objectives, I would kind of start it like this. So if the goal describes the future end state, which is, you can see the direct connection between that and the vision and mission statement, and it's starting to then identify what we would call outcomes. Other people would call it results. Other people would call it impacts. But if that's what the goal is trying to do, then objectives are where you're starting to get into a bit more detail, and we're going to just show you a couple different formulas, and Pam's going to walk you through the SMART formula, as it's called. So objectives describe the results to be achieved and the manner in which you're going to achieve them. So it's always goal objective relationship. So no matter which model you're using, I've never seen it the other way. And in some respects, let's say the analogy would be if vision is broader and mission is more the work we're going to do. So again, at a higher level, that same sort of inner logic applies to goals to objectives. You generally, they recommend at least two goals two objectives for every goal, just because it just kind of helps to give good shape to it. You can have more than that. We do caution against getting too many in there. some of the models suggest if you could keep your objectives, your strategic objectives, to a dozen or so, you would be in a great shape. And then if you think of that, um, it starts to become a lot of things to manage and keep track of. And particularly here, you're focused more on treatment and side. There's also going to be prevention and recovery objectives that are there. So try to keep it fairly manageable, but at least two per goal. Um, Again, this is another area where the way you define it and what they help you to do is to understand what is the priorities for doing the work and making progress in the work as you go along. And that's kind of what your message you're trying to get out of the objectives. Um, Lots of different advice about, sort of do's and don'ts of structuring objectives. This one we just talk about, try to avoid those, to-do verbs, to-do words, and verbs that would be hard to define. So understanding, knowing, those are quite difficult to measure. So they're just giving an example here of an objective. By the end of 2018, 75% of the program participants will be placed in permanent housing. So again, it's much more descriptive. You can still see there's lots of work that needs to be done to achieve this, but if you can achieve this, then you are moving closer to that goal, which is sort of above it. This is the balanced scorecards focus in terms of their model of a strategic objectives. So much as we talk about goals playing out at different levels, strategic, operational, program, project, process, and outcome, the same could be said for objectives. And so there's lots of different ways of looking at it. Here, they're just emphasizing focus on action, that, and in a way, those pieces that will give you the path to success to achieve that goal and get you closer to or consistent with your mission and get you closer to your vision. They really emphasize straightforward, simple, very few words. They do a verb object format, and those often in a balanced scorecard. These are the objectives that they work on, and then as they do other pieces, they get into a little bit more detail. These are some of those verbs that are used, and you'll see these time and time again, and these are some of the ones that they've found to be most effective. And then you'll notice at the bottom they give some examples of what difference. So train all employees might be a little bit more too specific in a sense, but improve knowledge and skills gets to the why you want to train all your employees. Advertising campaign is a thing, so it's a project or an initiative. But what you're trying to get at, the why you're trying to get at with your objective is to increase issue awareness. So a good model there, and fairly straightforward. There's this other piece that people talk about. So where we talk about goals are outcome based. You can also do objectives that are outcomes based. Again, what's the end impact and how does the end user of this? And so in this case, it would be not only yourself, but our clients. And then outcome objectives discuss a change in behavior. So we've increased, we've decreased, we've improved. We can also, and so behavior from, let's say, an organizational or a program point of view, but in this work, we could also be thinking about changes in behavior in terms of our clients or of our network of healthcare providers. And then they say, again, it gives you the milestones, some benchmarks along the way. A process objective, again, ends versus means, right? So where are we trying to get to? What are we trying to achieve? What's the end we have in mind? Process objectives, activities that we're going to do to get there. And my sense of most objectives is they're process objectives. They're more, they're more thing oriented. They're more the means we're going to do to get there. So we're going to develop, we're going to implement, we're going to establish, we're going to conduct. And they really are more getting right towards activities and project steps. So just to understand the distinction, and whether you're looking at goals well, frankly, even applies to vision and mission. Vision is end, mission is means, goal.
Looks like Harold has dropped off the line. We'll try as hard as we can to get him back. Sorry, folks. Hi, Harold, are you back with us?
Test 1, 2, test 1, 2.
Okay, we can hear you again.
Yeah. So sorry about that. I'm not sure what happened, but everything in my computer started shutting down. So I apologize for that. All right. So yeah, that was interesting. I'm going to just pretend like it never happened. So again, distinction between ends versus means, vision and mission, ends versus means, goals and objectives, ends versus means. Within each goal or within each objective, you can be focused on goal, ends versus means, or outcomes versus process. Um, Most of them are, when we look at them, and we're going to show you some examples even from SAMHSA and the National Institute of Drug Abuse, um, which you'll see. I think you'll see the distinction in there, and you'll just see, in fact, the. I hope you'll see the flexibility you have in terms of drafting, because even though they look at the SMART formula, we could all analyze to see how well they applied the formula. Um, what we have here is this next slide that we're on now, ends versus means. What I have is 10 statements here that are ends or means statement. And what I'd like you to do is take a moment to identify which ones you think are ends versus means. So outcomes and impacts are ends, uh, projects and activities and means. So just give a moment to do that, and I will show you the answers, by the way. And the purpose of this exercise is really just as you're shaping your goals and objectives, is to sort of be able to understand the distinction there. Because, when you look at the formulas, you don't have a lot of words in your goals and objectives. So it's a fairly concise statement. And as Pam had noted, goals can be one sentence. When you look at those balanced scorecard objectives, sometimes they're 3 to 5 words. The formulas we have are longer than that, but again, in their model, they're very sparse with their wording. Again, just take a look at this list of 10 and make a list or in your own mind, which one is an end statement, which one is a means statement, which one's an outcome statement, which one's a process statement, which one's an impact, which one's an activity in terms of ends and means. So just assuming so eliminate the cause of birth defects, provide counseling and support to victims of crime, make a profit, increase shareholder wealth, assure that comprehensive, culturally acceptable personnel and public health services are available and accessible to First Nations people, conduct biomedical research, heal the wounds of crime, increase the mental health of our clients, provide leadership training and legal assistance to migrant workers, decrease the problems of single-parent children, and provide food and shelter to the homeless. And here is a take on which one of these are ends or purpose, statements, or means and program statements. Okay. And again, if you download the handouts TOR in the file section, you'll have all these slides plus these, including this one that sort of tries to help you to make that distinction in your mind about and in your drafting about ends versus means. In some respects, I would say the more at a strategic level you can be ends focused, that's helpful. You do want to make sure there's that strong connection between your program goals and objectives or your proposed goals and objectives as sort of the means statements. So just in terms of formulas for drafting, I've already showed you the balanced scorecards, what they call their verb object format. Here's an example from above. Increase access to services is a strategic objective in that model. This next one's a bit of a formula, and it's in some respects similar to the SMART formula, but just sort of treats it in a different way, right? So the direction of the change, the area of the change, the target population, the degree of change, and the time frame. So, and they've just underlined each of those sections to reduce the unemployment status of our graduating students so that 75% are fully employed within 6 months of graduation. So even though this is a fairly straightforward, a short sentence, there's a lot going on in there. And then the third model we wanted to show, and this is the one emphasized in the FOA, and which SAMHSA is emphasizing as well in its work, is the SMART acronym. And Pam, let's turn it over to you for that.
Okay. So SMART stands for each of these letters, and the word SMART has little reminder prompts that can help you craft a SMART objective, and these are the ones that SAMHSA recommends. The S would first stand for specific, so including the who and what of the program activities. You're going to use only one action verb to avoid issues with measuring success. And the example here is outreach workers will administer the HIV risk assessment to at least 100 injection drug users in the population of focus. And that is a more specific objective than outreach workers will use their skills to reach out to drug users on the street. So in other words, just being as specific as possible and assuming that the person reading these objectives may not have the benefit of all of your knowledge and experience, and you know what it is you mean if you were vague and just said outreach workers will use skills and help drug users, but to be very specific to particularly a funder or a policymaker to make sure they know exactly who are you speaking about and how many, and a little bit more detail there. So then going from the S to the M, or is measurable, how much change do you expect to make? Is it possible to count or otherwise quantify an activity or its results? And so the source of and the mechanism for collecting the measurement data can be identified, and that the collection of the data is feasible for your program. They recommend that a baseline measurement is required to document change. So you're trying to measure the percent of increase. We want to increase access using a particular, with an objective, you would describe how you intend to do that. And then, or if you're going to decrease, so how much do you intend to increase? Are you increasing access by 15 more individuals per month or per year? Or are you going to decrease the number of overdoses by 5 per week. In other words, being very specific no matter which direction you're going in. If you plan to use a specific measurement instrument, it's recommended that you incorporate that right into the objective. So, as measured by what? By self-report or by a survey, or how would you know? So the example here that is provided by SAMHSA is by September of 2018, increased by 10% the number of 8th, 9th, and 10th graders who disapprove of marijuana use as measured by the annual school youth survey. So this is a very important, you can see the detail here. You've included when do you intend to achieve this, by what percent, so 10% over whatever the baseline is now, and to whom. It's the 8th, 9th, and 10th graders. And how will you know if you achieve that? Well, we'll look at the measurement of of the youth survey. Did it go up amongst these 8th, 9th, and 10th graders by 10%? So it's very specific. So is it achievable for the A? Objectives should be attainable within a given time frame and within available program resources. So the example is the new part-time nutritionist will meet with the 7 teenage mothers each week to design a complete dietary plan. And that's certainly more achievable than teenage mothers will learn about proper nutrition. So you're making this something that is not only achievable, but something that you can count. Is it realistic? So objectives should be within the scope of the project and propose reasonable programmatic steps that can be implemented within the time frame. The example from SAMHSA, that 2 ex-gang members will make one school presentation each week for 2 months to raise community awareness about the presence of gangs. And the statement is that is a more realistic objective than gang-related violence in the community will be eliminated. First of all, we rarely get enough funding from anyone to eliminate anything, nor do we often have control over all of a situation to know whether or not we will even be able to achieve something. So you have to be able to have some span of control in order to be able to make these reductions or increases depending on what you're trying to accomplish. So make sure that it's realistic within your purview so you're not signing up to save the world when you really can't do that. And then lastly, time bound. Provide a time frame indicating when the objective will be measured or a time by when the objective will be met. For example, 5 new peer educators will be recruited by the second quarter of the first funding year is a better objective than new peer educators will be hired. I do want to make a note that we got some kind of a warning, as I guess it is no secret that there's some technology difficulties that the university is experiencing, and we got a message that we might be disconnected soon. I'm hoping that's being fixed, but if we were to hang up abruptly, we did not intentionally do that. So let's cover just a few objectives while we still have connectivity. So by June 1st, 2018, the local educational area supervisory staff will have trained 75% of health education teachers in the local school district on the selected evidence-based substance abuse prevention curriculum. So this is a very good detailed objective. It tells you when do you intend to achieve this, who is doing it, which is the supervisory staff of the LEA, will have trained 75% of the health education workers will have been trained by that date, and it will happen in the local school district, and they will be trained on an evidence-based substance abuse curriculum. So I think you get the sense here that every one of those requirements was met with this particular objective. Another example, by 11/30 of 18, on board 2 opioid use disorder clinical staff and 1 outreach worker to deliver TOR therapeutic services to 20 tribal members each month. So again, it's trying to take the example of a potential objective and give you that in the TOR language. So we're going to stop there and see what kind of questions you have, and I can only answer questions in the chat box, and I'm hoping that we have our moderators back on board here. They should be back on momentarily.
Yeah, and I sent both an email and I also sent out presenters chat to them, Pam. So I haven't seen them come back. So I feel like we're walking on eggshells here.
Hi, Harold. Can you see me in the
I
chat?
think it was page 40. Ah, there you are. You popped back in just
Oh,
now. It's your there. Okay, you're back.
hopefully that'll stop us from cutting out here. Again, if you have questions,
Yeah, we can relax a
please
little
just
bit.
type them.
Thanks, Jeff. Um, yeah, so we're not sure what that. Did you get cut off, by the way, or was that just an errand warning that we got? Okay, interesting.
Adobe
Yeah,
Connect
'cause
works in mysterious ways.
yeah, Pam got that and I got that. No telling how many, if any, of the participants got that. I just was pointing out as we're waiting for questions from the participants, but I was just pointing out, Pam, I believe it was on page 46 of the FOA where SAMHSA went through its recommended definitions and approach to goals and objectives. Is that correct?
So can you hear me? I'm not going to be able to interact with you all because I have to totally shut down your voices for me to be able to speak.
Okay.
This whatever is wrong with the phone system there is quite is hampering this. So I cannot answer you in an interactive way. I'm going to go look at the RFP now and see whether or not it said this on page 46, and then I will come back and answer. But also, if y'all, I think all the grantees were able to hear your conversation because I was hearing it over the loudspeaker.
All right, thanks, Pam. I understand. Yeah, so sorry for that difficulty. And then Cheryl did put in the chat notebook that yes, it is page 46 where the SMART goals are described. I also wanted to note that sort of as you look at the language of the examples that were given above, I think they can be, in some respects, many of them can be modified if needed to be to your current context. As long as there's a couple things, as long as you're what I call that inner logic between the relationship between objectives and goals and mission and vision and priorities. As long as that logic is there, I think you can modify these words. And so, for example, there was an objective there about gang members speaking in the school. I know from my network in Indian country that a number of the groups working on their opioid strategies really do want the recovery community to be actively participating in those discussions, and particularly in that public education and awareness pieces that may fit there. So there's a piece of that, and you are going to look at I think the other internal logic is the relationship between the proposed goals and objectives that you had in your proposal and your narrative, and then your scope of your funding that was provided, and then how they connected that to the what we call the requirements, like strategic planning and addressing gaps that you see in the FOA itself. So again, we'll keep it open for questions. But what I'll keep doing is keep moving through the document. Because the other thing, what we tried to do in this next section, and we're going to get Pam back in to talk a little bit about the template. So two things. We took a look at a couple of existing strategic plans that are related to drug abuse, or one SAMHSA specifically, which has an opioid priority. And for a couple of reasons. One, from the SAMHSA point of view, the work you're doing in the TOR is in fact one of those mechanisms through which SAMHSA is achieving its strategic objectives and its strategic goal and addressing its priority. And I'll read it. It's called Combating the Opioid Crisis Through the Expansion of Prevention, Treatment, and Recovery Support Services. So here's an example. If you open it up from the files, the SAMHSA strategic plan, this is my effort to summarize their 30 or 40 page plan. And, just to give you that sense, so you'll see the connection. There's their vision, there's their mission, there's their core principles, they have and then they list their priorities. So in some models, I would call those the core strategic directions. Some would call them the strategic themes. Again, it doesn't really, to me, it doesn't matter what you call them, as long as everybody that's in your sphere of influence um, recognizes what you're doing there and sort of is aligned in that way. So um, the other reason I'm showing this is so again, this was when they did their work, whether they did it alone and then they or did it collectively and then they got it approved through their chain of command. These were the resulting goals and objective statements. So in terms of opioid, there's the one specific goal to reduce opioid misuse, use disorder, overdose, and related health consequences through the implementation of high quality, evidence based prevention, treatment, and recovery support services. And then in the next page of the table, I've taken the language that they've used for their all their objectives, but again, in column one, their priority one on opioid, you do see those there. So in terms of opioids, they're going to strengthen public health surveillance. By the way, the other thing that they do, they have another section following this, which then says, and here's how we're going to do it. So in this model, then they would have goals and objectives. So these could then these next how-to items, I call it, these could be their strategies, or these could be their activities, or these could be their tasks. So again, how they worded, they chose to word them as the how-to section. And so if the goal is if the objective is the why, the goals and objectives are the why and the how, and where we're going. Then the how-to is the what is of what we're going to do. So strengthen public health surveillance, advance practice of pain management, improve access and access to utilization of and engagement and retention in prevention, treatment, and recovery support services. 1.4, target the availability and distribution of overdose reducing drugs. So when you look at that, and I didn't really analyze the how-tos that much, but I would suspect that you would then be able to see both of these objectives. Actually, if you look through this whole thing, I think you could then see where the FOA, the TOR, and your work sort of aligns and connects to that. So how you are informed by and how you are contributing to these particular goals and objectives. Also took a look at the National Institutes on Drug Abuse, their current strategic plan. Again, just to show you that they do a different layout in a sense, but their priorities. So again, they have a mission statement. They didn't have a vision statement. They just had a mission statement, and then their I would call them their four priorities: basic science, prevention, treatment, and public health. And then a goal statement under each one of those. And again, fairly straightforward in their language, but as you read them, you can see they really sort of provide an anchor and an opportunity for lots of other elements in terms of activities or objectives and activities. I put their objectives in just so you would see again the wording that they used. And so while let's say SMART or the calculus about change and targets that we gave, or the balanced scorecard formula for objectives, this is kind of how it all plays out sort of in the real world. And so to me, I think you have a little bit of latitude in terms of that. Looking at those formulas helps you to sort of in that first, second, third draft, how many iterations you need to go through to really, nail those goals and objectives. They just help you to give some good shape to it. This one here is actually a Canadian example, and I just put it in there only because I couldn't find a lot of strategies, actually. I found a lot of strategy discussions. I've heard that there is some strategies out there in some of our Canadian neighbors, First Nations communities, and at sort of not necessarily at the community level, but more at sort of, let's say, the tribal council or the tribal organization or the regional organization kind of thing, sort of the USETs of the world or the Tanana chiefs of the world, kind of at that level. Or let's say South Central Foundation, sort of in terms of the First Nation side of the health, the health apparatus. So this one is essentially saying they looked at the data they had on misuse and deaths in the province of British Columbia, sort of drew some conclusions from there, and there's a standalone report on that. And then it concludes with basically a very brief chapter which says, here's the action framework, the framework for action we're going to pursue. And I just put this in there only because I know a number of the tribes and organizations are specifically looking at action plans or other kinds of planning tools. And so this one is uh, prevent people who overdose from dying, keep people safe when using, create an accessible range of treatment options, and support people on their healing journey. And I can't really read it that well when you look on the screen, but again, if you download it, you'll see it a little bit better. Plus, in terms of some of those things they do to sort of have that comprehensive frame to their strategy, and there is a bit more the language you see in these boxes is a bit more objective oriented. So Pam, we are coming to the slides that you had put in relative to opioid use disorder and MAT. So I'll just give you a moment to plug back in. And I'm just going to.
Okay, so now we're going to look at the activities. So we've talked about, the broad goals and the detailed objectives of, by when and by whom and by how much will you undertake the tasks. And now we get into what I would say is more the multiple activities that have to be accomplished in order to even reach that objective, which then in turn would help you reach your goal. So here's an example of some sample activities. One might be if you, for example, if your goal was to expand access to medication-assisted treatment, and that was your goal, you couldn't wave a magic wand and suddenly it happens. There's a whole lot of things you have to do, and one might be that in your particular tribal community, you might not have a lot of opioid use disorder prescribers. So you might not have the physicians or the waivered prescriber staff, the ones that are trained. There are some nurses that are able to do this now, and also the physician assistants, some PAs that are now able to be a medication prescriber. So you might end up having to identify them. Who are the practitioners that might be willing to prescribe a medication-assisted treatment for opioid use disorder. You might have to then connect the potential prescribers to the training that would enable them to actually prescribe the medications, because there's I believe it's about a 24-hour DEA waiver education program that they can participate in. It can't be just that they're willing to do this. They have to receive this training, and normally it's a lot more involved, but in an effort to get more prescribers on board with being able to be a medication-assisted treatment prescriber, the feds have reduced the burden of how much training you have to have. So one of them might be, identifying who's willing, and then whoever's willing, will they then get this training. You have to advertise clinical staff for clinical staff, because we don't just medicate and go. We don't give them their prescription and say good luck to you. We then work them into some therapeutic service delivery that is concurrent to their medication. And so perhaps to do that, you might, if you're going to be expanding access to MAT, you'd have to then have more clinical staff. So, where would you advertise for them? You'd have to interview them. You'd have to select them. So those are all step-by-step things you would do. And so maybe you're going to use multimedia to do that. Maybe you're going to advertise your openings in maybe a local tribal newsletter or paper, or on the television or radio stations that are popular with your tribal community members, so that folks from the community know about these advertised clinical positions you're trying to fill. And then, of course, you have to hire them, and then, of course, you have to train them to get them ready for their job to work in tandem with the medication-assisted treatment provider. So, and the prescriber. So you would obviously maybe want to use some of SAMHSA's terrific materials that they have, and that you might include that as one of your activities to make sure that folks have the benefit of good information. Another example, you might want to reach out to the National Alliance for Recovery Residences, NAR, to identify MAT-capable recovery residences. And if you were writing this, you would say in our jurisdiction. So you might be aware that there are recovery residences that belong to a national, like an association. And so they reach a certain level of quality, and they offer this recovery support in residential, various residential formats. And so there's these are located all over the place. But if you were wanting to make referrals to individuals who are getting MAT that might need some recovery residences in which to live while they're pursuing their recovery, then you might want to find out where these are and reach out to them. And so you could even go into more detail, you know, identify, do you have any? If you do, make an appointment, go see them, you know, schedule time for them to come meet with you and meet your staff. You know, these are all different activities that you might have listed one by one. And then involve our staff with lived experience in meaningful roles in developing the recovery housing options used by our program. So that line came straight out of your funding opportunity announcement, in that SAMHSA says that if you are going to pursue recovery housing, that they want you to involve staff with lived experience to make sure that they have a meaningful role in that whole delivery of recovery housing, making sure that the program is suitable and is meeting the needs of your particular tribal members who would be accessing it. And we also have some strategic activities planning templates. I think the first couple, Harold, you might go over. Well, let's see. First, this one is the strategic activities plan template that we created for you to have as an example. Just as a reminder, you would clearly define and state the problem your strategic plan will solve, and identify the activities that need to be completed, identify and analyze the epidemiological data that might inform your tribal needs associated with the identified problem. And, you know, before you jump into all these solutions and objectives and activities, you want to have a good handle on what the problem is, because it looks different in each community. You might consider your tribal capacity, strengths, and challenges when you develop this plan. You want to be careful what you sign up for, that it's within your scope of practice, your scope of capacity of what you currently are able to do, and that's something that will grow over time. You want to embed your tribal traditions and values into your planning activities so that what you're accomplishing is meaningful. And then we already talked about developing the objectives that are measurable and define the accountability, who's going to do it and by when, and timelines and resources and so forth. And so this is the first page, and what you'll see in the red is we attempted to fill out to give you an example of these, and you might remember that when we created this template, we created it with required activities, which had to do with your strategic plan itself and had to do with your medication-assisted treatment, which was a requirement. And so then there were some other activities and some optional activities. And so I think we run you through a couple different examples here. So if the goal up above is to increase tribal member access to MAT, again, that doesn't say by when, by whom, you know, how many, but now we're saying here, okay, apparently we're having some major audio problems. I'm getting a text that we're having audio problems again, guys, in the phones. Anyway, I'll continue, hoping that some people can hear, that by December 30 of 18, secure agreement from 2 medication-assisted treatment prescribers to serve our tribal members with opioid use disorder. So you see here the objective has the date. We're saying exactly what we're doing. We're going to sign up to get 2. We're going to increase access by getting 2 new MAT prescribers on board for OUD. And then we're going to, and they're going to serve specifically our own tribal members with opioid use disorder. We would do that by identifying potential OUD prescribers. You have to find out who they are. I guess I should say MAT prescribers, but for OUD. Connect potential prescribers to MAT waiver training, and there might be many more. Then we have the responsible parties. You know, who would do it? Maybe your medical doctor is the best one. Oops. Okay, so let me go back here. So on this first one, you're the responsible party to, you know, sometimes it helps for doctors to reach out to doctors or medical personnel to reach out. So maybe your tribe has a medical doctor. That might be who you ask to do that particular activity, and then the target date. You might have your project director be the one that reaches out for setting up the training, the waiver training. You know, then we go down. Another one is by another objective to meet the same goal up above. So, you know, Harold said it's always good to have 2 objectives or so. So another, you know, you won't just increase medication-assisted treatment by just having the making prescribers available, because how would everybody know, how would your tribal members know that there's a availability now to get medication in their own tribal community? So to do that, you might want to onboard staff, not only the clinical staff that would then support that medication, but also to have outreach workers who would go out to find the clients and get the word out to the tribal community that these services are now available. So that's another objective. And you might do that by advertising clinical staff openings, using tribal multimedia sources, and also hiring and training clinical staff using some of SAMHSA resources. And so you see, you know, who's going to do it and by when. I'm going to now just stop talking for a minute and to check in and make sure that we still are connected. And so, Harold, when I unmute, if you can just let me know, is everybody able to hear still?
Yeah, Pam, you actually, as you noted in the chat, it picked up, I think, in the middle of the presentation. You might have turned more towards your microphone on your phone, so the volume seemed to improve a little bit there, so I would thank you for that.
Okay, and I am in a totally fixed position and literally have not budged from the time I started. I'm like a statue, so I did not move at all, but I'm going to continue hoping that whatever it is gets resolved. So thank you. And now it will move on to the second. Just another goal would be, let's say one of your goals is to increase tribal member access to recovery support. How that would happen, one example might be by January 30 of 2019, finalize 2 or more MAT-capable recovery housing options for tribal member referral. So that might be your goal, your objective. And then what would you do to make that happen? You know, many steps that would have to happen. You have to reach out to NAR to find out where are the MAT-capable residences near me. Involve your staff with lived experience and meaningful roles, you know, so that they can help make sure you're getting some good recovery housing options. Again, who is going to do that? When is that going to happen? And you'll see that we put, you know, objective 2.1.3 XXX. That just means many more of these activities might be needed in order to successfully get to the objective. Then if we go to another goal, let's say now our goal is, these are one of the allowable activities, is to increase effectiveness of MAT with your tribal members. And so that's a very big goal. So how might you accomplish that? Incorporate evidence-based and traditional American Indian, Alaska Native practices in your TOR program design. And so you might want to start by first reviewing what are the effective practice registries that might show what might be effective in terms of some of the evidence-based practices that would support MAT also, and what would that look like? And also then you might even have pull some tribal members together to review these effective practice registries and identify some effective traditional practices that might also support somebody that is receiving medication-assisted treatment. And just an example might be some ceremonial approaches or some talking circles or some other kind of tribe-specific cultural or wisdom practices that would work together with the medication to get a good result. And so you might want to review those and then pick one and then find out, are these practices that you already have within your tribe, or are these practices that were developed by another tribe or by some developer that worked with tribal members to create some practice that you might want to incorporate. And so whatever your steps are would go right here in the 3-1, 3-2, 3-3. And then who would help you, who will take lead on these, and then when the dates would be. So I'm going to stop there, and again, since I'm sorry I can't hear back, I'm going to just look in the chat box, but I am going to then turn my mic off and listen to what else is happening.
Thanks a lot, Pam. I really appreciate that. And again, as Kate has on the chat room, just want to thank everybody for their perseverance and patience in helping us deal with these technology issues. It's odd. I thought Adobe Connect worked great, the last one, and now we're having a few issues. So I do want to open up the chat room for conversations. Again, I'm still waiting for the brave soul who's going to use the hands up. I think we've had one person who's done it in all of the to be able to ask a question or share some thoughts over the microphones. I do want to remind everybody to look at the poll down at the bottom right of the screen in terms of would your members of your team be willing to attend the conference in Mystic Lake in April? And we will talk about that at the end of the session. Just in our next set is to really do the closing pieces. And the last thing I want to mention as I'm sort of looking for some questions or any commentary is a number of people had mentioned that they were moving rapidly through their planning process, whether it was a strategic plan or some other framework. And a couple of people had offered to share them once they had taken them through their approval channels on the tribal side. And to the degree you can do that, that would be fantastic. Just sending it through, I think through the technical center would be great. Because then we'll try to build that. We'll look at those as quickly as we can and build those into the conference call we have or the webinar we have on Monday, which is really about getting to, what are we seeing, what are we hearing about the successes of tribal groups and organizations, tribal and Alaska Native groups in terms of aligning with existing plans, updating existing plans, doing new plans, doing opioid-specific plans, or modify or utilizing other frameworks, action plans, for example, to support their work on the TOR. So I just want to encourage you to do that. We'll follow up by sending out an email to those folks who did offer in previous chats. And then again, for background information to everybody, you go to the site and to the links, which will come up in the next few slides. You'll have access to all of the webinars, all of the documents, all of the PowerPoints that have been used in terms of, again, having some good reference material as you're working your way through the process and drafting, whether you're going to draft an opioid response specific vision or mission, or look to see the connection between your work and existing tribal and Alaska Native visions and missions. So just share some of that information with us. I'm not seeing any questions, so perhaps I'll turn it back over to Jeffrey to do our closing slides and just a note um, about a little more information on the April meeting. And Cheryl, I note that you said you are going to use your tribal action plan and other documents that we have completed for a lot of this work. And I'm just wondering if you would be willing to share that and maybe email Kate or Jeffrey. Jeffrey's emails at the very last slide we're going to go through. And so if you could, if you're using something like that, it would be great for us to be able to see that. Because again, as we try to shift our attention to give much more increasingly practical advice and helping the recipients respond to some of the key challenges that we're seeing across the country in terms of this process of shaping or building a strategic frame for the work that you're doing. That would be very helpful to us. Other than that, Jeff, I'll turn it over to you because we're already at, according to our clock, we have 4 minutes left.
Okay, thanks a lot, Harold. And thank you to everyone who attended and pushed through these technical difficulties with us. And thank you to the 14 people who have completed the poll at the bottom. I see that's only about half of you. For the rest of you who are online, please just fill that out. We just need one click. We want to gauge how many people are interested in coming to this face-to-face event. Like I said at the top of the meeting, this will be a chance for grantees to meet face-to-face, share their action plans, and collaborate on some common problems that they're encountering. Looks like we see Pamela can't reply to vote until we know more information. Okay, Pamela, what are you? Oh, who should attend? I assume grant funds pay for attendance. Purpose of the conference. Just more info. Okay, we're still finalizing details. We do not have an agenda yet. I'm sorry for that. But I do not believe the grant dollars will pay for the travel, but I will confirm that and I'll reiterate that on Monday. I'm sorry, Cheryl.
And Jeff, there was one other subpart to her question. Is this the annual conference noted in the FOA, NOA, or is this a different gathering?
I believe this will be that annual conference. Dorothy, the plan for the December 12th and 13th meeting, this is actually a delayed event. We looked at the flights and the venues and people's schedules, and we found that many people could not attend in December. So we've postponed the December meeting to April.
And this is Pam. I'm hoping you can hear me. This is actually not the grantee meeting that is in the grantee, in the FOA. That would be something that would be with your project officers. This is a voluntary technical assistance training where we intend to bring physicians who have, Indian physicians with medication-assisted treatment experience, tribal members who have had success with opioid use disorder treatment with MAT, tribal providers who have successfully delivered MAT in conjunction with some traditional practices, some basic OUD education. We're looking to provide a range of relevant topics that might be of assistance to you. And so it will not be the grantee meeting, and I'm not sure whether you have one or not. You would have to work with your GPOs on that. And then as to whether or not you could use funds from your grant to travel, I think that also would be potentially a GPO question, but it would also depend on if you put any money in your grant line items for training, because that's what this would be. And there's no fee for the training or anything like that, but it would be the expenses to get there and to participate.
Okay, Pam, thank you for that. Thanks for keeping me honest.
I'm going to stop talking so I can turn you back on here.
And Jeff, the only thing I would add to that is I know in our early discussion we also talked about sort of this would be, let's say, 4 or 5 months into the strategic plan, so that might be a sort of a good opportunity into the project, and people have, after they've finished their strategic plan, so this might be a good opportunity to sort of do a bit of an assessment and sort of a checkpoint on let's call it, performance of the strategic plan relative to the projects itself.
That's right. Thanks, Harold. Are there any other questions that people would like to post in the chat?
And so maybe while we're waiting for that, Jeff, you want to work through the final slides?
Sure. Our upcoming webinars, like I said, our next webinar is on the 19th, and we have another one after Thanksgiving on the 28th. As a reminder, these strategic plans that we've been covering, they need to be completed by the end of the month. But we will also schedule webinars for early December for grantees who are looking to refine their plans even after they've been submitted. As a reminder, we have our TOR resource page, which I pasted in the chat. There you can find all the resources that we have right now in the files. So if you don't get a chance to download them before the end of the meeting, we will post them to the resource page. We will also post recordings of our previous webinars and the handouts, the slides that you've seen today. And a reminder, we still haven't gotten very many grant proposals. We're looking to see all of your grant proposals just so we can better refine our presentations and suit them more towards your needs. So if you have not sent your grant proposals yet to JBS, please send it to the email on the screen.
Jeffrey,
and it looks like.
Go ahead.
Oh, go ahead.
I was just going to point to Cheryl's comment. Is there a cap of pages for the strategic plan? And let's say from a generic strategic planning point of view, not really. When you look into the sort of the slide above, slide 10, which talks about the process, generally we've estimated somewhere between 3 pages to 40 pages. So, and a 40-page would be pretty involved if within the body of the report you're getting to 40 pages. And you know, that's not counting the attachments you might include. So, so just let's say for the narrative portion of a strategic plan, that's generally the range, and it's often determined by the size and complexity of the organization or the project, and also by the time available for it. I don't know if Jeff or Pam kind of have any insight on the terms of the cap relative to this specific FOA or the work of the project officers from SAMHSA.
We are not aware of any cap that has been put on this. It just needs to be reasonable for what you proposed in your application, so that if you promised, 5 different things that you would do, then they would expect to see those 5 things in there. In your plan, and so to make sure you've got that consistency, since that was what was approved by the grant reviewers, and then also that it's realistic for the budget. So, if you overpromise things that you can't afford, then that might be troublesome. On the other hand, if you have a significant amount of funding, but you're only proposing to serve 5 new people, that could be a problem. But in terms of the actual length, you want to make sure that it lines up with what you promised you would do.
Yeah, maybe the only other thing I would say is if you look at the tables that were put together on the SAMHSA and the NIDA strategic plans, so I think those are in the 20 to 30 page range, those specific plans. And on the SAMHSA one, I was able to boil it down to a table in 2 pages. And still make it relatively readable if you're looking at the downloaded version. Only thing I would say is I might have added a 3rd page of the how-tos, only just to give let's say the bullet point of what the how-tos were, and in a way, in those 3 pages, you would have then had essentially the core or the heart of SAMHSA's strategic plan in your hands. So that might be a useful tool for you to think about once you've done the drafting or whatever the process is to really think about, is there a way to sort of do I like to call it either the published version or the marketing version, which you could then use to really in a way, focus on the key moving parts of a strategic plan. But other than that, Pam, I just want to check with you if there's any final comment. We're a few minutes over, but just make sure you, any last words?
No, I'm good. I just appreciate everybody again dealing with the technology problems.
Okay. All right, and final word to you, Jeff. Otherwise, we'll see everybody who's able to join us. We'll hear everybody or type with everybody on Monday.
Thank you everyone for joining.
Jeff?
Again, if you have questions, you can send them to me. My contact information is in the contact and support box. And thank you for bearing with us today. We will try to get these technical issues fixed for our next meeting.